I'm Dr. Natalie Johnson. I'm a toxicologist here in the School of Public Health studying early life exposure to harmful environmental pollutants. Specifically, our lab is interested in early life exposure to pollutants in the air. In fact, previous studies have shown that women during pregnancy exposed to high levels of air pollutants are more likely to have children at risk for developing asthma. So in our lab, one of the major focuses is investigating the mechanisms and prevention strategies for reducing the harmful exposures during pregnancy. Today I'd like to share with you a couple of the projects that we're working on in the laboratory. One of my master's and doctoral students will tell you a little bit more about the details of the cutting-edge techniques that we're working with.
Hi, my name is Jairus Polchinski. I'm a master's in public health student in environmental health under Dr. Johnson, and I'm using analytical chemistry to assess air pollution exposure among women who are pregnant. And I'm doing this using a machine called the mass spectrometer, and it's a very highly sensitive machine that allows us to quantify these chemicals at quite low amounts.
We're currently applying these techniques in 2 pilot projects to explore air pollution exposure during pregnancy. These projects will be conducted along the Texas-Mexico border as well as in eastern China.
In these studies, we'll be looking at urinary and blood metabolites in conjunction with a comprehensive exposure assessment that includes personal air monitors.
The way these personal air monitors work is they can be placed in a small backpack that's lightweight. Our participants can carry with them throughout the day, as well as set by their bedside tables at night.
The personal air monitor draws in air through here at about the same rate as the human lung. We can then analyze a filter on the air monitor in our lab and examine their exposure to air pollution.
Overall, we'll use these robust exposure assessment techniques to quantify exposure and identify those at highest risk during this critical time point of pregnancy. Our overall goal one day will be to identify those at highest risk so we can provide preventive interventions to reduce the impacts of air pollution during this time period.
Hi, my name is Crystal Riklick, and I'm a doctoral student in Dr. Johnson's lab. We're also using lots of animal models, from simple models to more complex. And first I'm going to talk a little bit about the hydroorganism, which is a small freshwater organism closely related to coral. We can use these organisms for toxicity testing, and so we would expose them to certain pollutants and then see if we can prevent that toxicity with different compounds. To transition into higher level organisms, we're looking at a mouse model of asthma, exposing pregnant females to diesel exhaust particles, a large part of air pollution, and we're looking at the effects of the diesel exhaust on the offspring.
Using these animal models, we're studying both the genetics as well as the epigenetics, how genes are expressed, to better understand asthma susceptibility following prenatal environmental exposures. We plan to use these new biomarkers that we discover in the laboratory and translate them back into human populations. Overall, our research here in the School of Public Health spans many fields, from studying the mechanisms at the cellular level to translating back into human populations at high risk for these environmental exposures, one of the many goals of public health.